to the beginning real quick for our PCOS friends that are listening that heard all the wonderful things berberine can potentially do for their body. With our PCOS population, is there women in there where berberine maybe isn't the right step for? Like, how do they know if they should be advocating for berberine in their care plan?
It's a difficult question to answer. And part of the reason is because PCOS, not every woman with PCOS looks alike. Okay. And the interesting thing about PCOS is that even the healthcare providers who are supposed to be the experts on PCOS, if you put 100 of them in a room and ask them to tell us how you make the diagnosis of PCOS, it's like, fist fights will break out. I mean,
right.
Okay, because there's several different criteria that, there's the NIH criteria, there's what's called the Rotterdam criteria, there's the Androgen Excess Society's criteria, okay? And so some women with PCOS have signs of testosterone excess, the hair, skin, weight, okay? Some don't. 80% of women with PCOS have high BMI, they're overweight, okay? But maybe 20 or 30% even have what we call lean PCOS. They have normal body weight or they're thin. Well, how is that? Well,
right.
Nobody really knows for sure. So I would say, and then the other obvious main issue with PCOS is, either absent or irregular periods. If you stop ovulating, that's why you can't get pregnant, right? I mean, you don't know when you're going to ovulate. You don't know how to time intercourse. So the answer to your question is, I think since berberine's primary benefit, at least in the short term, the primary benefit is that it improves insulin sensitivity. And there's now some studies showing that you can combine it with inositols and you get an even better sort of 2-for-1 synergy because they work in different ways, but they accomplish the same end. So a woman who has signs of excess testosterone or knows that her blood sugar is a bit out of control, her what we call HbA1c is elevated, okay? Those are women who are probably really good candidates for berberine and inositols, okay? Insulin sensitizers, okay? A woman who is thin, has no signs of androgen excess, but is not getting her period except maybe 2 or 3 times a year, and then they do an ultrasound and they see cysts on her ovaries, so the doctor says, you've got polycystic ovary, okay? Because she doesn't really have the signs of androgen excess, maybe not. Maybe the inositol insulin sensitizers are not going to be the right step for her.
Right. And so that person would maybe just want to be digging a little bit deeper into why we aren't ovulating before jumping to certain supplements.
So the whole concept of lean PCOS, it's funny, there's a movement which periodically kind of you hear from that says we should rename this condition, okay? Because it really is a misnomer, okay? Polycystic ovary, an ultrasound, if you look at the ovaries on ultrasound and you see lots and lots of cysts, that's one of the signs. But it's not always the case. Right. Some women have all the other signs, but their ovaries are normal, okay? And so there's always a group at these meetings that says, we want to talk about renaming this. And then everybody shouts them down.
I remember this a few years ago being a big hot topic.
Yeah, hard enough for us to get attention for this condition and the kind of research dollars that it needs. I mean, it's 8 to 10% of all women.
Yeah.
Right? And it's not like something that goes away.
Yep.
It's with you for a lifetime, and it leads to metabolic syndrome and increased cardiovascular risk. And so it's definitely something that is underserved currently. And so they're worried, especially the PCOS challenge people. It's like, oh, no, don't take the name away. We're just getting the kind of traction that
right.
we need.